Many healthcare providers have never seen a case of measles. Because the measles vaccine has been so effective, it is important that you, as a healthcare provider, are familiar with the clinical presentation of measles so you can quickly diagnose it and reduce the spread of the virus in your clinic and community. Because it is so rare, measles has sometimes been misdiagnosed as Kawasaki's disease, roseola, dengue, or scarlet fever. Misdiagnosis can delay your ability to implement critical measures to stop measles from spreading. So you should consider measles in the differential diagnosis of patients with clinically compatible symptoms. Measles should move up on your differential diagnosis if your patient has not been vaccinated against measles, recently traveled internationally, or may have been exposed to someone who recently traveled abroad, or lives in or has traveled to a community where measles cases are currently occurring. After the incubation period, which is on average 11 to 12 days, symptoms typically begin with the fever and the 3 C's: cough, coryza, and conjunctivitis. There is a stepwise increase in temperature, which may exceed 103 degrees Fahrenheit, which is 39 degrees Celsius. 2 or 3 days after symptoms begin, an astute observer may see Koplik spots, which are small white spots found on the buccal mucosa. 3 to 5 days after symptoms begin, the characteristic measles rash breaks out. It usually begins as a macular-papular rash, or flat red spots with small raised bumps that appear on the face at the hairline and spreads downwards to the neck, trunk, arms, and then to the legs and feet. The spots may become confluent or joined together as they spread from the head to the rest of the body. It is also important to note that fever should be present when the rash starts. This helps differentiate measles from other rash illnesses like roseola. This picture shows a classic case of the rash caused by measles. Notice the intensity of the macular-papular rash on the face and trunk. Measles is more difficult to see in patients with dark skin. If the rash is accompanied by other symptoms, such as cough or conjunctivitis, measles is easier to diagnose. For information on clinical features of measles, visit cdc.gov/measles/HCP.